have a person get an infuser port placed to allow our nurses to give the medicines and fluids and such. And we give this medicine, again, the preferred approach is to give it in a higher dose once every 3 weeks during the course of radiation. Okay? That's the preferred approach. Sometimes we will give it once a week during the radiation.
We're going to do chemo once a week.
No, sir.
Every 3 weeks.
That would be the preferred approach, unless I have a reason not to do it that way. And that's why I said I have to coordinate this with Dr. Simmons.
Right.
Okay?
Originally, he was thinking that I wouldn't need chemo, but
well, and again, so that's what I was getting at before. So the options would be surgery up front, but that's a major surgery, disfiguring, as you said. You could do radiation alone, but the radiation alone likely would not be curative. Likely would not eradicate.
I agree with that.
So then you do the combination of radiation and chemotherapy, and the basic reason for the chemotherapy is to make the radiation stronger. So if you said, look, I'm only going to do one thing, okay, radiation or chemotherapy, I'm not doing both, then I would recommend radiation. The chemotherapy helps improve the benefits of the radiation. So it increases the cell kill, but it also increases the side effects, okay? So let me talk to you about the chemotherapy in particular. The chemotherapy, again, drug called cisplatin. This is given through the vein, and often, again, we'll have...
How do you spell that?
We'll get to that, okay? Let me go through it, and then... Okay. So, as any chemotherapy, novel medicines have possible side effects, all right? The hair can come out, but it does grow back. Sometimes a little different shade or texture.
I ain't got much anyway, so...
People can have nausea and vomiting, and that can be a major issue with this. And so I try to be very aggressive in nausea medicines. I would give you a prescription of what's called a MEN to help with this. And we want to be aggressive with hydration, giving you lots of fluids. Especially as you're getting the radiation, you may have symptoms of nausea, which makes it harder to eat. And then you're getting radiation here, which makes it hard to swallow. Okay? Me personally, I probably would prefer a feeding tube, but it sounds like you've already addressed that issue. Well, we can talk about it. I'll talk to Dr. Simmons about it. It can cause hearing loss, predominantly in the high frequency ranges. It can cause kidney damage. It can cause numbness of the fingers and toes, called neuropathy, and sometimes that's not reversible. It can affect the blood counts, making the red blood count or the white count or the platelets low, putting a person at risk of bleeding. On a rare occasion, needing a blood transfusion. It can make the white count low, putting a person at risk of infection. I tell every patient, no matter what I'm dealing with, no matter what disease we're talking about, is that something unexpected or unforeseen can happen and a person can die as a complication of their treatment. What I need to do today is I need to get some labs on you. I would recommend getting an infuser port placed to allow our nurses to give you fluids and medicines through it. I need to get some additional information from Dr. Simmons so I have some of the additional records, okay? And then I need to coordinate with him on his treatment regimen, his treatment plan, on how, what he's going to do, okay? And then I can, we were talking about, so I have to see your labs and make sure they're okay before we can say, here's the chemo we're going to do, okay, before I can order that. Once we've made a decision, hey, this is what we're going to do, this is how we're going to approach it, then what I will do is we will arrange for you to undergo an education session with our nurses, and we'll get things started with Dr. Simmons. We'll coordinate it to where you can start pretty much on the same day as he does, okay? So that would be my plan, all right? Come on up here for me, please. If I could get you just to, you don't have to take off your shirt, but you can at least undo it a little bit. Now, I will tell you, it's not an easy go, okay? As far as treatments are concerned, it's kind of difficult. Because, again, you're talking about getting radiation in an area that was never intended to get a really bad sunburn.
Right.
So when you can't swallow, it's hard to stay hydrated. We don't want your kidneys getting affected because you get dehydrated and everything. I mean, you're a really healthy guy. From what you've told me, it sounds like you're an extremely healthy individual. So from a physical standpoint, I think that you're someone who's going to tolerate things. But I'm just telling you that from my experience, on anybody. I mean, I've got patients who are in their 40s who are doing the exact same thing that you are, and it's not easy. Okay, so the other thing, so I'm not as worried about eating as much as I am staying hydrated.